Hi everyone, I'm John Hammerly with the Plastic Surgery Channel, and we're here today to talk about a subject that I think everybody wants to know. When is the right time to use lasers? Should you wait until I've got some significant discoloration wherever, or go for it right away?
I think it's a tricky question, the way
Well,
you
that's why I'm
worded
here.
it. The way you worded it, because you said significant discoloration. I will tell you that I feel like I'm a big believer in prejuvenation, as they say. I think that neurotoxins can postpone static lines. I think volume replacement can go a long ways. Laser, however, is usually aimed at a specific problem. Now, can we intervene earlier before it's significant? Yes. I don't think that I would approach someone who has youthful skin that's got a smooth texture and tone and color. I don't think that you need to prejuvenate that with laser. You need to go after a problem. Now, you can do it before it becomes a big problem.
I don't think you can prejuvenate genetics, right? And that's a big component. And a lot of the damage we did to our skin is early. I'm on the verge of like the baby oil era where you like rubbed it, you got your first burn of the season. And a lot of that damage was done years ago. So I'm chasing what I did years ago in those choices. So I do think that, catching some of these things early with maintenance, simple lasers, facial peels, nothing aggressive is great. But I have a lot of gals that come in and they have like leather skin and they're like, hey doc, and they don't recognize that I'm doing like an aggressive laser to like set back the clock. But this is just a setback. There's lots of maintenance there too.
Right. And that patient that you just described oftentimes thinks, oh, I'll just do a laser. Yes. And they don't recognize, even when I'm doing full surgical facial rejuvenation, the longest kind of long-term result is with the laser. That's where they're going to have the longer recovery, and by that I mean like pink or prolonged redness. And the more the problem they have, the more aggressive the laser you use, the longer the recovery is going to be.
Christy, is it your experience where patients are smart enough now, educated enough now to come in and say, I need a laser, or do they come in saying, what can you do? And you're the one to talk laser.
I think it's more, what can I do? They may come in with some buzzwords with this whole direct to consumer marketing, but it's more, hey, my skin sucks. What can we do? And they're, I think getting folks started on skincare early. There's no good replacement for sunscreen and washing your face and some of those things. So we're chasing a lot of bad decisions in addition to genetics early on. But I don't have people coming in specifically saying, I need a laser. I do have them coming in saying, though, like, we need to fix this, something's happening here. I got a lot of texture issues, color issues. They'll say those buzzwords.
And they might ask, like, what would you think of this? Or do you do this? Because there's a lot of that out there. But ultimately, they're sitting in my office because they want the advice. Mm-hmm. And like,
education.
And you said it, the youth is wasted on the young. Like, oh, if we could go back in time and not do those dumb things that we did.
If you've got any other questions about plastic surgery, go to theplasticsurgerychannel.com.